Hello, welcome to Oncology Spotlight Expert Insight. I am Yüksel Ürün, your host for today. I am medical oncologist at Ankara University, Turkey, and interested with GU Oncology. Just after the ASCO GU Cancer Symposium, we will discuss abstract number 16 from ASCO Genitourinary Cancers Symposium, which is presented by Maha Hussein. This is BRCAAway trial, which is overall survival from the phase 2 trial of abiraterone, olaparib, or abiraterone plus olaparib in first-line metastatic castration-resistant prostate cancer with DNA repair defect. By note, in this study, patient with BRCA1, 2, or ATM alteration included in this trial. In arm 1, abiraterone, in arm 2, olaparib, in arm 3, olaparib and abiraterone combination used, and upon progression, crossover was permitted for first 2 arms. And actually, the primary endpoint of the study is radiographic progression-free survival and secondary endpoint in overall survival. In oncology, this is one of the fundamental questions for us, whether in patients with metastatic diseases start with combination or use this agent in sequence. And of course, the question is whether combination of the treatment will improve oncological outcome, and the second, whether this combination will bring more toxicity or not. So it is really one of the very important, although this is small size of the study, the question is very clinically very relevant question. And when we come to the efficacy, combination arms show better overall response rate, progression-free survival, and overall survival too. When we come to the progression-free survival, in ABI arm, the median progression-free survival was around 8.6 months. In olaparib arm, it is 14, but in combination, it is more than 3 years, 39 months of the median progression-free survival, and the hazard ratio is 0.3, and which is really very effective and very significant trial. Of course, with crossover, you cannot get same amount of the benefit. So we cannot say using this treatment in a sequence will provide the same benefit. When we come to overall survival, actually, again, with ABI plus prednisolone, it is 28 months. With olaparib, it is 37 months. And with combination arm, it is more than 5.5 years. It's like a 68 month of the overall survival. Again, comparing with ABI prednisolone or olaparib, is hazard ratio between 0.39 and 0.51. So what we can say, in patient with selected mutation like a BRCA1, 2, and ATM, in patient with metastatic castration-resistant diseases, starting with combination provide longest survival. Median is more than 5 years compared to either agent alone or sequentially. So what we can say, and also the data from other combination study in patient with HRD mutation, especially BRCA1, 2, and the ATM, starting with combination of the PARP inhibitor and androgen receptor pathway inhibitor, seems associated with better survival. And as I said before, although this is one of the phase 2 with small size, it is like a proof of concept and shows us significant efficacy, significant benefit. So I think this is one of the important and clinically practice-changing study from the ASCO Genitourinary Cancers Symposium. Thank you for the listening and hope to see you soon in the next one.